Hi, I'm Dr. Dan. Welcome to this webinar, which is all about breathing dysfunction. So what exactly is breathing dysfunction? So many people ask me, I'm a dentist, and how did I come across breathing and breathing dysfunction? So one of the main reasons is because of my own health journey. I went through all kinds of different treatments, including mandibular advancement splints and orthodontics, for my TMJ issues and for my snoring and sleep apnea. But it wasn't until I came across breathing retraining that my health really changed, and I can now do without all of those appliances as a result of changing my breathing patterns. And people say to me, well, how can changing your breathing affect those sorts of symptoms that you had, like headaches and neck aches and jaw aches and those sorts of things? And there's plenty of good research now showing that breathing dysfunction, as well as things like anxiety and other stress factors, have a really big impact on things like jaw clenching or bruxism. So many clients or patients will come to me saying that they have jaw problems and saying that they have pains and headaches as a result of that. And they're expecting me, because I'm a dentist, they're expecting me to put some kind of a splint in their mouth in order to fix their jaw problems. And whilst I often give them that as an option, in my experience, if the client is willing to make some lifestyle changes and also to do some changes with breathing if necessary, in my experience I often don't need to put these things like orthotics and splints into people's mouths in order to help them with their symptoms. So why is that? Well, basically the clenching of the jaw and just tightening of the body is very much a stress response to our environment, whether it be a nutritional stress factor, whether it be some kind of postural issue, or any other stress factor like an exposure to a chemical or something else. Any stress factor is likely to create a fight-flight response in our body, and part of that fight-flight response is clenching the jaws and teeth together. So in an evolutionary sense, if a saber-toothed tiger was going to square up to me or run up to me, hopefully I would run away because there's not much chance I'm going to fight them. But part of that response would be a tightening up of my muscles and a clenching of my jaw. So as a dentist, what I've now found is that I've sort of done myself out of a business in one sense, because I used to make an awful lot of TMJ orthotics, and now what I'm finding is that I'm not having to do that in many cases. Even cases where there is a dysfunctional bite and there's a less than ideal position for TMJ, whilst changing that can have amazing effects on people, and I'm not saying that we should never do that. What I find though is that about 80% of these clients, if they actually go through changing their breathing patterns, if they need to, then their jaw problems seem to go away. And part of the reason for that is probably because they're going to be spending about 5 lots of 12 minutes a day for anything between 1 and 3 months, just taking some time out and sitting upright in a chair in good posture, nose breathing nice and gently through the nose. So some of the thing that they're getting there is perhaps just taking some time out from their busy days, and that in itself would have a de-stressing effect. But also what they're doing is they're changing their carbon dioxide levels by learning to breathe in a different way. And this webinar is going to talk a lot about the effects of carbon dioxide on the body. So many of us go to physiology textbooks and we can find all kinds of different norms. So for example, we have minute volume, temperature, pulse, blood pressure, all these different types of things. And many of us are aware that blood pressure should be, for example, 120/80 at rest. Most people know that the pulse at rest should be about 70 beats per minute. But many people, including health practitioners and including myself before I became interested in breathing, didn't really remember anything about this minute volume, which is how much air we should breathe per minute. So for the average human being, for the average adult at rest, it should be about 4 or 5 litres, which is around about the same as the average lung capacity as well. So when people breathe upwards of that minute volume, so for example, if you're breathing 10 litres, or in this case here 14 litres per minute, what can happen is that the oxygen and carbon dioxide balance is affected, and so our ability to oxygenate our cells is diminished, and we can get all kinds of symptoms because of this breathing dysfunction. So if you went to the average hospital ward where you see people who are not very well, quite often you'll see their chest heaving and you'll see them breathing these big volumes of air. If you compare that to someone who's perhaps really healthy, if you look at an average athlete at rest, you'll hardly be able to tell that they're breathing. And so when we're healthy, we breathe this normal volume of air, and as a result, we get normal levels of carbon dioxide and oxygen in our body, and we are more likely to be healthy. I think it's a big problem that many health practitioners sort of forget about, this 4 or 5 litres of air per minute at rest, and people may go to their doctors with symptoms of asthma or congestion or snoring, those sorts of things. And many times I find that this gets overlooked, and it is something that can be altered. And during the breathing retraining programs that I do, and also when people wear the Sleepy Strip product, what we find is that the minute volume comes down. And when we bring that minute volume down, we get more healthy. So normal body parameters should be normal in order for us to be healthy. So just like if you went to your doctor and they measured high blood pressure, you'd expect them to give you some advice to try and bring that high blood pressure down. As a breathing educator, what I'm trying to do is bring the minute volume down to a normal range. Okay, so over-breathing all day or breathing this big volume of air leads to some kind of symptom. The symptom can vary according to your own environment and also your own genetic makeup. So for example, if you're someone who has the asthma gene, when you over-breathe, your carbon dioxide level may fall, and when that falls, if you've got the asthma gene, your smooth muscle in your bronchioles has an effect of collapsing, and when that collapses, you get your symptom of asthma or a difficulty breathing. In my case, if I overbreathe, I quite quickly get a blocked nose and I get symptoms like hay fever. So everyone's symptom can be different, but the overarching problem is often this overbreathing, which comes from all kinds of different causes, and of course there's a webinar on the causes of these breathing dysfunction as well. So overbreathing looks like this. So typically around about greater than 4 or 5 litres of air per minute. Often it's audible. It's usually chest dominant breathing as opposed to the diaphragm, and it's usually greater than 8 to 12 breaths per minute. And of course normal breathing is the opposite of that. So when you watch someone who's breathing normally, it should be silent at rest and certainly more diaphragm than upper chest. So when people come into the breathing clinic, this is the kind of thing that I'm looking for. You know, is the chest moving at rest? Can I hear them breathing at rest? Are they mouth breathing? Those sorts of things. So what's wrong with breathing more air? Well, what happens is in atmospheric air there's not very much carbon dioxide at all. There's around about 0.03% CO2 in the air that we breathe. And inside our body we need around about at least 3% in order to get good oxygen transfer. So ideally we want around about 6.5% CO2 inside our body. So if I go from breathing normally to sort of hyperventilating and intentionally taking in more air than what I need to, what happens is I'm only taking in 0.03% CO2, but I'm giving out at least 3%, which is 100 times more than what I'm giving in. So the net effect of that is that the carbon dioxide level will fall inside the body. And when I put someone on a capnometer, which is something that measures carbon dioxide levels, in my experience, every time I ask someone to breathe more than they normally would, I see the carbon dioxide falling to a certain point, and then of course the body then kicks in and it stops the CO2 level from falling too far. But if we breathe too much air, the default level of CO2 that we sort of carry around with us all day long tends to be a little bit too low. So Christian Bohr came up with the fact that hemoglobin reacts differently to different levels of carbon dioxide. So when carbon dioxide is low, hemoglobin will pick up oxygen more readily, and when carbon dioxide is high, it will give off oxygen more readily. So hemoglobin is this amazing protein where when it gets to the lungs, where carbon dioxide is quite low, it will pick up oxygen, and when it gets to the cells and tissues where oxygen is needed, because carbon dioxide is higher at the cells and tissues, it will release the oxygen to the cells and tissues. So if I'm breathing too much air all day long, and my default level of CO2 is too low because of that, what happens is my hemoglobin is less able to oxygenate my body. So every cell in the body needs oxygen in, nutrients in, and the ability to transfer waste products out. So when carbon dioxide is too low because of over-breathing, the ability to get the oxygen in the cells is diminished. And this graph is quite difficult to get your head around. You have to sort of go away and read about it a little bit, but if you Google the Bohr effect and the saturation curve, you can read a little bit more about it. But essentially it just explains that phenomenon about the CO2 gradient and how hemoglobin will release oxygen more readily. So this here is a screenshot of a capnometer. So the capnometer, the client will wear a nasal cannula, and the capnometer will be measuring the air that they're breathing and the air that's coming out of their bodies. In particular, it's looking at carbon dioxide levels. It also tells me things like how the patient's breathing. Are they breathing nice and consistently, or are they breathing erratically? And I can also simulate what happens at certain times. So for example, I could ask someone to simulate snoring, or maybe just open their mouth and breathe through their mouth, and I can see what happens to their carbon dioxide level when they do that. So what you're going to see now is a client of mine is on the capnometer. The initial graphs here is just when she's been speaking, so the breathing pattern is kind of up and down quite a lot. And now you can see the particular pattern here is, this is her default pattern. So it's nice and smooth, relatively consistent, but this black line here denotes carbon dioxide level at about 35 millimeters of mercury. This is her default breathing pattern here, and then what I've asked her to do here is to start doing something called reduced breathing, which is breathing in a slightly different way in order to try and elevate her carbon dioxide level. So from this point here, just where the graphs start to be smooth, to here, she's just doing a slightly different breathing pattern. The net effect of that is that she's now experiencing a slightly higher level of CO2 from what she normally would experience. And so in doing so, if she spends enough time in this state of elevated CO2, her brain's going to get used to a higher level of CO2. And when this happens, if it happens often enough, via a process called habituation or using something called respiratory neuroplasticity, we can actually change this lady's breathing pattern. And you can see that gradually, as she goes deeper and deeper into this breathing pattern, you can see that these peaks of these graphs here are just getting a little bit higher than that black line. When I put this machine on at my default level, I'm somewhere up here. She has breathing dysfunction, so she starts down quite a way below the line. And then when she's doing this breathing pattern that I'm asking her to do, she's up above the line. She's breathing around about sort of 14 to 15 breaths per minute on average. But the main take home here is that she's starting to spend periods of time in a level of slightly higher CO2. And if she does that often enough, it can change her trigger point that makes her breathe. So in someone with breathing dysfunction, their brain is asking them to breathe more often because they're not used to a normal, healthy level of CO2. But in these cases, when we get people used to a higher level of CO2, their brain is asking them to breathe less often. And the net effect is that increased minute volume that normally they would have is coming down to a more normal level. And so the symptoms that they get from their breathing dysfunction can be changed. Now, of course, while she's doing this, I've just asked her here, just so you can see what's happening here, I've just asked her to slow her breathing down and to put a little bit of a gap in between the breath, just to see what happens. So you see she's breathing, and then she puts a bit of a space in, and then she's breathing, and what you can see in here is that the carbon dioxide levels increased even further. So not only is she breathing slightly less air, which is the reduced breathing technique, but I'm getting her to slow her frequency of breathing down, so that further increases her CO2, which is why you can see these occasional spikes of slightly higher CO2 here. Okay, so it's just important to realise that this is obviously this is just a conscious thing that she's doing, so she's physically putting herself in this different breathing pattern. The point is, if you do this consciously for long enough, your unconscious breathing pattern that happens when you go and do the shopping, or when you're sleeping, or when you're doing something other than this, the unconscious breathing pattern is altered, provided that you're doing these kind of breathing patterns on a regular basis. What I want you to do is not to do your reduced breathing just for a moment, but just to sit relaxed I just want to see where your breathing's at when you're just sitting relaxed without doing anything. And then in a moment we'll sort of see where you're at. So we'll just give you another 30 seconds or so of just being rested. Not doing reduced breathing at this point, just normal breathing without any real input. Okay, so if you could just start doing your reduced breathing now, so just that ever so slightly less air in, relaxing on the exhalation. That's it. Awesome. Okay. I don't know whether you can see the screen from there, but what's just happened is you immediately increase that CO2 quite nicely. So just keep with that reduced breathing pattern. We'll just sort of see where it goes to. Nice. Whatever you're doing now, that's the kind of thing that you want to be doing when you're at home. So I'd just like you to try doing what you're doing now, except just maybe count like 1.5 seconds in between your breaths. So rather than breathing as you are now, just try and see if you can just put like a 1.5 second in between your breaths. So not even 2 seconds, just a slight space. Very slight, not very much, just slight. Perfect. See if you can maintain that. If at any point you feel like you can't maintain it, that's fine. Go back to doing what you were doing before. Excellent. What you're doing at the moment is what I'd like you to do between now and next week, whenever possible. So just slightly less air in, and also just a slight space. When I asked you to do this the other day, you were probably just putting a bit more of a space in between the breath, and it didn't really do much change, much improvement. And I think just putting that slight space in between the breath is really working for you. And you've just a couple of times nudged 40, which is really good. It's just a nicer, more calmer breathing pattern. So this is the pattern you're going to try and remember when you get home. So people typically have to come to me for 4 days on the row. I'll see them for about 90 minutes each day. We'll do lots of breathing exercises. We'll talk about breathing awareness and various different things that you can do to help reduce your breathing pattern. And then they'll go home and they'll spend about an hour each day doing various breathing exercises for anything between 1 and 3 months. Overall, when I then see someone like this at the review about a month later, I should see that their default breathing pattern has changed so that they have a slightly higher level of CO2 from what they did before. Okay, so, and it's important just to know that literally it's immediate. So a change in breathing pattern, whether you ask someone to snore or whether you ask someone to hold their breath, we'll see an immediate change in the end-tidal carbon dioxide, which is what's being measured here. Okay? So the point is we consciously spend extended periods of time in this slightly higher level of CO2 in order to change the unconscious breathing pattern. There's a great YouTube video, which you can see the link here, and you can, if you go to that YouTube video, you'll see a girl blowing up a balloon. And I don't know whether any of you ever tried to blow up a balloon for a party, but if you blow up a balloon too quickly, usually what will happen is you'll get a symptom of dizziness. My belief is that every symptom in the body is a gift from the body, and it's the body's way of telling us that we're doing something we shouldn't be doing. And so in the case of dizziness, when we blow up a balloon, that's happening not because we're not taking in enough oxygen. We're taking in plenty of oxygen because we're breathing more air than normal in order to blow that balloon up. But what's happening is we're giving out too much carbon dioxide into the balloon. And so when we give out too much carbon dioxide, the hemoglobin, like I said before, is not releasing the oxygen so effectively. And so the effect of that, the reason why we get dizziness, is because the brain is not being oxygenated properly. And so the gift from the body is to tell us that we're dizzy and to tell us that we shouldn't be breathing like that. Most people, when they do that, will stop breathing like that and go back to breathing normally. But if you override that symptom of dizziness and carry on over breathing into that balloon, eventually you'll faint. And that's what the video will demonstrate to you. So please have a look at that. I think the point of showing this is that I'm trying to show that the fainting reflex is actually a normal homeostatic mechanism that the body does in order to normalize CO2. So when you faint, you either stop breathing or the breathing slows down dramatically. And the net effect of that is that carbon dioxide increases in the body. So our cells are always creating carbon dioxide from metabolism. And when we faint, we slow the breathing down. Carbon dioxide then normalizes, and that then allows hemoglobin to release the oxygen to the cells and tissues of the brain. And then, of course, we wake up. So the fainting reflex in this instance is just a way of the body normalizing carbon dioxide levels. Okay, so there is these various misconceptions that deep breaths are good for us, and it's not always true. So when we take deep breaths, if we're deep breathing kind of all day long or too frequently throughout the day, that's a sign of breathing dysfunction. So when I see a client come in and maybe they sit down in the chair and they kind of take a big breath and lots of sighing and yawning frequently and things like that, all these things are signs of aberrant breathing patterns. So one deep breath in a time of stress can be extremely useful. So that's something that can really help us sort of reboot our brain in a sense. So if you're in a stressful situation, you suddenly take a nice deep breath, that can be really useful as a release for the emotions and also for anxiety and things like that. So I'm not talking about that type of deep breath, but deep breathing kind of all day long is a big problem and it's not good for us. And the paramedics know about this. When someone's wanting to faint or having a panic attack, they get them to blow into a paper bag. And what's happening when they blow into that paper bag is that we're recycling the carbon dioxide that we're letting out. We're breathing the CO2 back in, and that then enables the person who's having a panic attack to come out of their panic attack. So we're normalizing CO2, much like we would be if we fainted. Okay, and many people also think that mouth breathing is normal. If we look at any animals in the wild, we'll see that they don't mouth breathe. There might be a little bit of occasional panting, perhaps to reduce their temperature, to help them to have good homeostasis from a temperature point of view, to cool them down. But actual breathing through the mouth doesn't happen in the wild, and it's certainly not supposed to happen in human beings. The nose is an amazing piece of kit. It's got hairs to help filter the air. It's a much smaller space, so there's much more resistance in there, so it helps us to breathe a normal volume of air. It's also really vascular, which helps to warm and humidify the air before it goes down into the lungs. So if you breathe through the mouth, you completely miss out on this organ of the nose, and it's also a great part of your immune system. So we get nitric oxide formed in the sinuses, and when we breathe through the nose, the air mixes with nitric oxide, and that's fantastic from a point of view of being antibacterial, and it also helps to open up blood vessels and airways, reduces blood pressure and those sorts of things. So mouth breathing is not normal, except for when we're speaking, and perhaps during intense exercise would be the only reason why we might need to mouth breathe if things were happening in a normal way. Okay, so one of the reasons why I got into breathing in the first place, apart from my own symptoms, was that one of my mentors in my work with children's facial growth said to me, if I'm going to be good at what I do, I need to know a lot more about breathing. And I thought he was crazy. But after having followed the Buteyko Institute and also my work with MyoBrace and various other various other things. What I know is that breathing through the mouth has an effect on tongue posture. So when we breathe through the mouth, tongue drops down low, and so the tongue normally drives the growth of the upper jaw. So when we breathe through the nose, the tongue's up high in the roof of the mouth, and it pushes on the top jaw, pushes on the maxilla, and that helps the maxilla to grow properly. And when the tongue is down low, typically we'll get a narrow maxilla, and all kinds of other things like soft tissue dysfunction, like swallowing differently because the tongue's starting in the wrong place. So this is just a quote that I wrote: the ability of a child to thrive, grow to their full genetic potential, stay healthy, and avoid malocclusion is directly related to how they breathe. And although that's something that I wrote, so I'm going to be biased, I really don't think you could get that's the truth. It's in my experience when we change children from being mouth breathers habitually to being habitual nose breathers, the whole world just changes. So not only do we help get straight teeth for them, help to develop good swallowing patterns and those sorts of things, they start to perform better in school, and they start to sleep better. You can't really perform well in school if you don't sleep very well. If we're mouth breathing through the night, that's a stress on the body. When we have stress, our body's bathing in cortisol. Cortisol inhibits REM sleep, and when we don't get REM sleep, we can't have any short-term memory. So there's no wonder these children can't actually perform in school and pass their exams. And I've got plenty of cases of kids who have been labelled problem children, and then when we improve their breathing, all of a sudden they're just normal children like the rest of them, and even sometimes they're geniuses. So children really do need to breathe through the nose, so do adults. This is another YouTube link that you can have a look at, and it's showing about sleep apnea. So for those of you who may not already know, sleep apnea is where we stop breathing in the middle of the night while we're asleep, and it can either be what's called central, which means it's controlled by the brain, or it can be obstructive, which means there's actually an obstruction, like maybe the tongue going into the airway, or the airway collapsing, or perhaps adenoids and tonsils blocking the airway and stuff like that. So one of the main approaches to snoring and sleep apnea in the current medical paradigm is either using a CPAP mask to blow air down the airways to create like a pneumatic splint, or using a dental splint, an advancement splint, which helps to pull the jaw forwards and take the tongue away from the airway and open up the airway. So whilst these techniques have been shown in research to be really useful in reducing sleep apnea, my opinion is that they don't always help with daytime breathing patterns, and they don't always help with the actual habitual breathing pattern that this patient has. And so my approach is a little bit different in that I always advise my patients and clients that there are these options of CPAP and advancement splints, but my approach is slightly different in that I will usually encourage them to consider breathing retraining. So this means spending a certain amount of time, like I mentioned before, frequently doing these breathing exercises in order to use respiratory neuroplasticity, or the brain's ability to change the breathing pattern in order to try and get good improvements for the client. And many people don't have the time to do this, and in which case a CPAP or a MAS is a much better thing to do, in my opinion. But for those that are willing to attempt this, this is certainly something that I think is a good thing to do. And in my own case, when I had snoring and sleep apnea at age 31, this was the thing that helped me. So in many cases in my breathing clinic, people actually come to me who are already wearing CPAP machines or already wearing advancement splints, and they say to me that although they know that it helps their sleep apnea, they just can't tolerate wearing it, and often they say they can't go to sleep and things like that, or they don't want to put up with the feeling or the inconvenience of it. So for these people, I also work with these people to help reduce their reliance on these appliances. So typically I'll work with them for anything between 1 and 3 months to improve their breathing patterns during the day while they still wear their appliances. And then once I see improvements in their health and in their breathing patterns, then we can look towards the idea about weaning them from their advancement splints or their CPAP machines. So I make advancement splints myself occasionally, of course, for my patients, particularly the ones who don't have the time to put towards these breathing retraining clinics. But even those people who have got the advancement splints, they can come off of them, and the same for CPAP machines. So I showed before someone on a capnometer. One of my clients was doing some different breathing patterns to show the effects of CO2, to show the effects on the CO2. And what you see here is a slide of me wearing a nasal cannula, and I'm on a capnometer. So as you can see, I've got my nasal cannula on. I have it attached to a capnometer, which is a biofeedback monitor. It sort of looks like this. Inside there's a little vial of mercury, and it measures end tidal carbon dioxide, as well as breathing rate, breathing pattern, and those sorts of things. So at the moment I'm hooked up to the machine. In a minute I'll turn the recorder around so that you can actually see the screen that I can see. On that screen at the top you'll see various things like breaths per minute, and also end tidal carbon dioxide, and you'll see the pattern of breathing. And just bear in mind that when I'm talking, the pattern's going to be different. There's more mouth breathing, there's more breaths than normal, it's sort of up and down, that kind of thing. You'll see a horizontal line across the top, which is end tidal carbon dioxide set at 35 millimeters of mercury, and that's the line where really we want the graph to be above. We want to be above 35 millimeters of mercury. The majority of people that I put on the machine are below it. You'll see that most of the time my default will be quite a lot above it. I'm going to do a few different things. One thing that I will do is to show you my default breathing pattern by just being quiet for maybe 30 seconds. In addition to that, I will simulate snoring, so you'll see what happens. You'll see that immediately when I snore, the carbon dioxide will fall, and as a result of basically over-breathing for my level of activity, I'm not physically exercising or moving around, and so shouldn't be breathing so much volume of air. As a result of breathing a bigger volume, you'll see that my end tidal carbon dioxide will fall, and of course that will equate to a potential reduction in the ability of me to oxygenate my cells because of the Bohr effect. So I'm just preparing the screen now. Just give me one moment. So I'm just going to turn the camera around, and you will get to see what I'm doing. I will talk a little bit during it, and just bear in mind that when I talk there will be a difference in reading because I'm speaking, but you'll get the picture, and I'll explain a little bit as I'm going along. Okay, so I'm just turning the screen around now. Okay, so I'm just going to be quiet for a moment, and just so you all know, I'm also wearing a pulse oximeter on my finger, which is giving me a reading of my pulse, my oxygen saturation, which at the moment is about 98%. And because I'm speaking, I'm doing a demonstration, mouth breathing because I'm speaking, and I'm kind of in work mode right now. You see that my pulse rate's relatively high just now. It's usually down around about 68. It will probably settle. I'm also, of course, holding this in front of you as well. I should be pretty much rested down, but you can see pulse oxygen saturation is around about 98%, which is normal. We don't want 99 or 100%. That's a sign that we're not desaturating. We also don't really want lower than 98%. So you'll see what happens in a moment. Let me just let the capnometer settle. So no speaking for 30 seconds or so. And the number up on the top left there, 32.9, that's an average reading, so it's not really where I'm at when I'm breathing. You can see that I'm pretty much hitting close to 40 there. I'll just be quiet again to let that settle back to baseline. And you can see the EtCO2 has hit 41 just a moment ago. Okay, so that's my baseline. Now let's simulate snoring. Okay, so I mentioned before about some of the different signs of breathing dysfunction. So when I put someone on a capnometer, typically I'll see a lower default carbon dioxide level. That's not always the case, but it is usually the case. You'll see erratic breathing and sighing, inconsistency in the breathing pattern. The person will be breathless at times, and often there'll be movement of the upper chest. Normal breathing at rest just looks the opposite of that. So typically greater than 35 millimeters of mercury carbon dioxide. You'll see a consistent breathing pattern. The breathing feels easy and it's more diaphragmatic. Okay, so these are the things you've got to look for when people come into the clinic. Overbreathing is often mouth breathing, but not always. It's possible for someone to still overbreathe through the nose. It's possible to snore through the nose. It's just more difficult to overbreathe through the nose. It can be nasal. And with overbreathing, often there's a poor response to stress. So when I put people on the capnometer and I'm measuring their breathing pattern, I might just do a little thing to maybe stress them a little bit, perhaps by getting them to simulate snoring if their problem is snoring, or if they say that they get breathless during exercise, I might get them to do just a little bit of exercise and see what's happening then. But often there's a poor response to a stress when the breathing pattern is not good. Often there's congestion in the airways, so blocked nose and those sorts of things. Normal breathing at rest should always be nasal. We have a good response to stress when we're breathing normally, or a better response to stress, and less congested, and we have generally healthy airways, so we're unlikely to have enlarged adenoids and tonsils and things like that if our breathing is under good control. So just briefly, I'm going to go over what causes breathing dysfunction. There is a separate webinar entirely dedicated to this, but just very briefly, what happens in my mind is that we have breathing changes which create symptoms. So perhaps we go from breathing just not ideally, but all of a sudden we come across a stress factor, and when that stress factor comes to us, we start breathing even more. And when we start breathing even more, we get tipped over the edge into a time when we have symptoms. So the carbon dioxide levels fall enough to give us symptoms. So that symptom could be snoring, it could be asthma, allergy, congestion, those sorts of things. And there's all these different things in our environment that create these changes in our breathing pattern, all these stress factors. So it could be a physical injury, so someone may have just hit us or something like that. It could be an acute physical injury, or it could be a more chronic physical injury like chronic poor posture, for example. That will create breathing changes. Also various different foods we might eat, so dairy products might make us congested, lots of sugar might up the breathing pattern because it's stimulatory, those sorts of things. So the nutrition that we have is a big one. Exposure to chemicals, so any stress factor in our environment basically is something that could change our breathing pattern, because part of the breath's role is actually to respond to stress. Carbon dioxide is actually our main pH regulator in the blood, and so changes in carbon dioxide as a result of breathing changes and stress factors are really, really well controlled homeostatically. So there's all these things in our environment which can change our breathing pattern as a result of fight-flight. So anything that stresses our nervous system out can have an effect on increasing our breathing patterns. So I have these things called the 5 pillars, the 5 pillars of health: detoxification, nutrition, breathing, mindset and motion. And when any of these things are out of balance, then we can get too many fight-flight responses too regularly. And if we get these problems too regularly, too frequently, then our habitual breathing pattern can be changed for the worse. And it's those breathing changes that bring about symptoms of breathing dysfunction. So thanks for watching about breathing dysfunction. There are webinars that follow on from this one, causes of breathing dysfunction, effects of breathing dysfunction and also diagnosis and management of breathing dysfunction.